often get asked, what are the options for scar and treatment of scars and scar revisions? Well, there are multiple treatments for scars. Initially, massage is by far the best treatment. Even for old scars, regular massage or the introduction of a regular massage can make an enormous difference, especially if you use some very good topical serums or creams. However, sometimes massage alone will not be sufficient to improve the appearance of the scar, and it could be that other scar treatments may be required to help improve that appearance. There are many treatments that are now available. Use include a silicone gel sheeting. Please note that silicone gel itself is not really a particularly good treatment for scars, and silicone gel sheeting should only be used for adverse scars, such as those that are raised or lumpy, and they are called hypertrophic scars or keloid scars. So what are the other treatments available for scars? Well, we have many, from minimally invasive to more invasive. Would include, in addition to massage, you can use laser treatment to try and improve the color of the scars, to try and make scars less red. That can be very useful. But perhaps some of the most useful treatments are needling techniques or radiofrequency combined with needling. My preferred technique is actually medical needling and using what's called Dermastamp, and genuine derma roller and Dermastamp are really good techniques to try and help improve the quality of the scar. Sometimes that alone is not sufficient, and we can sometimes use other techniques such as subcision, which is where we put a needle underneath the scar, the tissues, especially where it's been tethered, to release that scar tissue. And sometimes we add in other treatments together with, such as hyaluronic acid, after we've done the subcision. This is especially good for acne scars as well. There are some other exciting treatments for scarring as well. We often find that chemical peels and some of the latest generation physiological enzyme reactivated treatments are very, very good to help improve the surface of the skin, and likewise with the scars. More innovative over recent times is the use of PRP, often with microneedling that we've just discussed. And PRP, platelet-rich plasma, and variations of PRP can be very good for the improvement of scars, and I like this treatment very much. We also have other treatments that involve literal injections into the skin, and that would include something called mesotherapy, where we can inject hyaluronic acid and also vitamins and minerals to help nourish the skin, and sometimes this can also help improve the appearance of scars. Moving on to more complex treatments, these are essentially surgical, although there's one other treatment that's very useful for acne scars and acne pitting scars, using trichloroacetic acid, where we actually put a little bit of trichloroacetic acid on a small stick, and we find that that actually helps create contraction and improvement in the appearance of acne scars. Lastly, and perhaps most importantly, is surgical scar revision. Now, those scar revisions may apply to scars on the face, the limbs, the legs, but often scars such as cesarean section scars or scars that have occurred as a result of other surgeries, and such as tummy tuck surgery or breast reduction surgery, or indeed breast augmentation surgery. And in these cases, we're able to revise the scars, really pay great attention to that scar management after that operation, so we have controlled conditions and we can improve the appearance of the scar long term by careful attention to detail after that scar revision. So scar revision surgically is a straightforward procedure that is usually performed under a local anaesthetic, but sometimes for bigger scars we have to perform these under a general anaesthetic, or sometimes an in-between, which is using local anaesthetic plus sedation or twilight sedation. In these cases, it's still a very safe procedure and the complications and risks are minimal. Again, the same things apply in terms of scarring, wound healing, and potential infection risk, and that applies to any surgery. So we often get lots of people emailing in to the office both in our Harley Street practice, the Banwell Clinic at Harley Street, but also the Banwell Clinic in East Grinstead. So if you do have a scar that you'd like an opinion on in terms of a scar revision, you're more than welcome to send photographs and images in, but please be aware that these have to be good quality, they have to be in focus, because otherwise it's very difficult to give an opinion. And obviously there's no substitute for a consultation where we can then discuss everything in detail and the treatment plan that is best for you.